Kathy, can you hear me okay?
Yep, I can. Can you hear me? I just don't,
Yeah.
all I see is I don't see anything on the screen yet. Do you?
No.
Okay, good. I was like,
No.
what's going on? I like left and came back.
Well, I hope my computer makes it through the meeting because it's the screen's bouncing everywhere here. I don't know
Oh,
what's going
well,
on.
my Wi-Fi's been super weird.
Uh-huh.
Well, it's just because everybody's on it again.
Yeah.
So, no, I can hear you. That's good. Okay, I'm glad I'm not the only one that can't see anything.
Okay, I see Rick Otino's on as well, but I don't see any audio for him.
Yeah, I don't see anybody.
Okay,
Okay, so
I'm going to go back on mute.
me,
All right,
same here. Okay,
I'm
see
going
ya.
to make some coffee.
Okay, it's 8:30. I'll call the meeting of the St. Croix Board of Supervisors to order at this time. And for our invocation this morning, Pastor Mike Roeder will be doing it for us. Please rise for the invocation.
Thank you so much for the opportunity to pray. Let's pray together. Heavenly Father, we are grateful today to come to you in the name of Jesus. Lord, our faith serves as a great perspective giver in these difficult and unprecedented times. And I pray that before we get into the minutia of all the details and deliberations, help us to get a 30,000-foot perspective of the world and the beautiful county of St. Croix County. Thank you for the many ways you've blessed us and provided for us. Thank you for the freedoms that we enjoy in this country. The scripture describes how you, God, have sovereignly established the governing authorities to promote peace and order and justice. Lord, we pray for the health of everyone in the midst of this COVID-19 crisis. Pray for all of those in the St. Croix County. And we pray for just your hedge of protection around the good people of St. Croix County. Thank you, Lord, for everyone represented here today. Thank you for every public servant. We're asking that you would graciously today grant them wisdom as they govern in the midst of this conflicting and competing interests. God, enlarge their capacity to understand the challenges and the opportunities facing them today. God, give them clarity on the important issues concerning our community. Give them compassion regarding the true needs of individuals. Give them an ability to equally represent each of our communities in the St. Croix County. God, grant us the ability to work together in harmony for the common good, for the general welfare, even when there's honest disagreement. Lord, we pray for the agenda items set before them today. Give them an openness of mind to listen well before coming to conclusions. Help them to serve the common good and what would benefit those who live, who work, and are in and around this beloved St. Croix Valley. God, steer our intentions to align with your perfect will. Guard our hearts and our minds from our own implicit bias. God, grant us your favor. Grant us wisdom as we deliberate here today. We're so grateful for our faith in you. We pray this in the beautiful name of Jesus. Amen. Which is which stands one nation under God, liberty, justice for all.
Okay, roll call, Cindy.
Ed Schachner. Present. Sean Anderson. Not present. Bob Long.
Present.
Kathy Leaf.
Present.
Kara Cook.
Present.
Tim Hall.
Present.
Paul Burning.
Present.
Rick Otino.
Present.
Bob Fiedler. Dave Osnes. Scott Counter.
Present.
Dan Hansen.
Present.
Scotty Yard.
Present.
Greg Telejohn.
Present.
Dave Peterson.
Present.
Paulette Anderson.
Present.
Judy Achterhoff.
Here.
Shelley Tomczyk.
Present.
And Bill Peavy.
Here.
18 present.
Thank you. Okay, for public comment, we will have public comment for 20 minutes this morning, and we'll do it in a random order, and I'll allow 2 minutes per speaker. So first one I have here is Sarah Blegan.
All right, thank you. My name is Sarah. I live in Hammond. I wanted to talk about our rights a little bit this morning. We, the people, would like to thank Supervisors Burning, Long, and Fiedler specifically for their efforts as they upheld their oaths to support the Constitution of the United States and the Constitution of Wisconsin and defend the rights of the people in the November 17th meeting during the supervisor discussion on whether to pass an unlawful communicable disease ordinance. You showed by your actions exactly what county supervisors and anyone holding position in government should do in service to the people, so thank you. I have a copy of the cease and desist, which was sent to each of you on November 11th, reminding you of your oaths and responsibilities to the people, informing you of each attempted violation of our rights and each criminal act being committed against we the people by continuing with the ordinance and any and all lockdowns or restrictions imposed on the people. This includes anything that may come forward. Several members of this body ignored this notice and did knowingly and willingly trespass on the rights of the people, committing action for neglect to prevent, deprivation of rights under the color of law, conspiracy against rights, conspiracy to interfere with civil rights, treason and sedition, and by definition under the Patriot Act, domestic terrorism. In short, you declared war on we the people, to which we will now seek remedy. By violating your oath, you have self-invoked Sections 3 and 4 of the 14th Amendment, which leaves you both professionally, personally, and criminally liable. One supervisor has already been served for these offenses, and there will be more today. Michelle? As a courtesy, we the people will provide you with the Constitution of the United States of America and the Constitution of the State of Wisconsin so that you may refer to them during the remainder of this meeting today and use them to guide your decisions. Thank you.
Adam, are there any online ones?
We have 3 people online. None of them have their hand raised. So I'd like to take this time to remind any of the online attendees, if you would like to provide public comment, please raise your hand and we will call on you. Are there any other public commenters in the room, in the boardroom?
Sarah Bachland.
Hi, Sarah Bachland, 573 Omaha Road. I just wanted to, I sent an email to the HHS board just in regards to the COVID dashboard. For the St. Croix County deaths, the death count, and where it separates it by age, they have information for all the people who have died, but not any for who haven't. And I was just asking that they could provide the non-fear information as well. And Adam and Kelly responded. And I just hope that you can reconsider adding that to the dashboard. So that's all. Thank you.
I believe it's Troy Keller.
Hi, my name is Troy Keller. I'm a citizen of Hudson here. I just wanted to bring up later on today, there's going to be brought up a code of conduct by Supervisor Fiedler. And as a constituent in the district here, I'm asking you to make a request to the chairman of the board to form a subcommittee to work on and adopt a code of conduct for appointed board members and non-appointed board members. There's been some complaints and some issues that have come up against Sarah Bachland, and there's a number of people here today that can speak to this, but I just wanted to make sure that constituents were heard, and this is brought up today. Thank you.
Is there anyone else here that wishes to make public comment? Seeing none, I'll terminate public comment at this time. We'll proceed on with the business items. First one would be the consent agenda. Do I have a motion to approve? Supervisor Osnes.
I'll second.
Second by Supervisor Long. Discussion? Seeing none, we're prepared to vote. All those in favor signify by saying aye. Aye.
Aye.
Opposed? Carries. Thank you. Presentations be the COVID-19 update. Kelly, go ahead.
So Ellie, if you want to do your screen share now, and you can start the COVID-19 presentation. Or I see Kelly's on now also.
I can go ahead and start. Good morning. Thank you for having me. My name is Ellie Clausen. I am the epidemiologist for St. Croix County. Today, I am just going to give the board the update on COVID through our new data dashboard. Okay, so we have updated our data dashboard. The way to find this dashboard has stayed the same through the St. Croix County website, through the COVID link, and it is listed as the data dashboard. We have done this update to provide more information for our community, be more transparent about the data that we are seeing, and be able to give them more information on the trends. As the previous dashboard was limited in terms of the graphs we were able to display and the amount of data we were able to show. So the first page we see here is a very brief summary. We talk about first the total positive cases. This is anyone who has tested positive for COVID-19 in St. Croix County. So currently we're at over 65,000 people in the county. We have a testing, and this is testing for those by PCR. So the test that takes a couple days to come back. It isn't the 15-minute COVID test. We have 22% of people testing positive for the county. We have had a total of 29 deaths and currently 15 people hospitalized in the Western Wisconsin hospitals, which are hospitals in Polk, Pierce, and St. Croix County. Our current risk level is orange, and we can get to that. That's on every page. To navigate through this dashboard, the easiest way is across here are the links for the different areas that might interest you. So we'll move to the current status. On our current status page, it's a daily snapshot of what is going on. So as of yesterday, end of day yesterday, we had 42 new positive cases in the county. And this means that public health received 42 positive tests from the labs conducting those tests. We had 33 positive molecular tests, which are those PCR tests. The state has defined these as confirmed cases. And then we had 9 positive antigen tests. These are the tests where it takes about 15 minutes. It's called a rapid test. And these are deemed probable by the state. We at Public Health give the same isolation notice, that 10 days, to whether you test positive by molecular or antigen test. You receive the same advice and guidance from Public Health on how to slow and stop the spread once you do test positive. The number we want to pay attention to always is a 7-day average. That's a smoothing. So when you look at the graph here, we're seeing on this green line the 7-day average, and this first graph here, we're seeing the past 30 days. So what has kind of gone on in the last month. Each blue line is our daily number of those PCR tests, and each yellow line is the daily number of antigen positive tests that come into St. Croix County. We can also switch the graph to look at our trend since COVID started in St. Croix County. We can see our largest spike happened around the middle of November. We have been on a downward trend in number of cases in our county. Since then, what we have seen is an increase in this yellow, which is those antigen tests. That piece, I believe we've now seen kind of a shift back, but it's a very early trend to where more PCR tests are coming into our county. Cumulative tests, this last graph, this is just the total number. So on that first page where we saw that 66,000, that's where this is all the tests. And we can see by the slope of this line where the greatest number of tests were added the fastest. Okay. Now, back to this 22, this is a metric which is linked here. If you click on the our current risk level, it'll bring you to the Harvard metrics. These are metrics that are given levels for indicators of risk levels. The DHS website also provides indicators. So right now we are at the orange level, which means we are no longer in red, which is uncontrolled spread, but we're kind of at that tipping point. We still haven't brought it down to a yellow or green level within the county just yet. Moving on to hospitalizations and deaths. Hospitalizations, we have, as I said before, this is just more information here. So we have those 15 in Western Wisconsin hospitals. Those are listed here on the page. And then we're also looking at bed availability. So kind of what is the burden on our hospitals due to COVID? Currently in Western Wisconsin, we do have greater than 10 ICU beds available. Should someone need to be admitted. In the Twin Cities Metro, they still are at a yellow level in terms of bed capacity and transfers between residents here in St. Croix County to the Twin Cities or to other hospitals in the area. Now, unfortunately, there have been an increase in deaths in the county. In the beginning of December, we were at 22 deaths. We are now at 29. What this graph beneath the total number of deaths is looking at the age range of those that have passed due to COVID or where COVID was a contributing factor to the death. Also, this tab is available here to look at the gender distribution of those that have passed. If we want to get more information on those who have tested positive in our county, we look at demographics. So this is the age category and distribution for all residents who have tested positive. We see our highest numbers in the 40 to 60-year-old age range, 40 to 59. But followed closely by our more mobile, interactive social groups, kind of our 10 to 30s. That is kind of the next group where we see the most cases in St. Croix County of our residents. In terms of gender, it's about 50-50, and ethnicity, the grand majority at over 80% are not Hispanic or Latino. If you want a more specific number, please go ahead and hover over any of these values to get the percentages that relate to the graph here. You're also able to remove sections if you click on the actual title on the section of the graph. All right, moving on to testing. What has been going on in terms of those testing positive for COVID in our county? We do have about a 22% positive COVID-19 test by person. And these, again, are just the confirmed cases. So all of those antigen tests that we saw that have lately come into high popularity, those are not included due to the fact that negative testing is difficult to measure and record for the state to allow us that information, with antigen testing being the primary way that long-term care is doing their testing of their residents and healthcare workers. So it seems here that we've been pretty stable in the past 30 days. If we look at the all-time, we do see that this was that great spike, our huge, so let's just remove this and the positive test, and we can look just specifically at the trend. In the trend, our spike was right here in the middle of November. Well, what this data here shows is that actually we were still finding the same amount of positives. We just had a lower number of people testing, kind of up until prior to Christmas, around Christmas time. And then once the Christmas holiday, we have seen a drop off in testing, as well as we've kind of seen, as well as a small drop off in those who are testing positive. Now, just looking at since the 25th-ish of December, that's a very short amount of trend to look at and to really take any solid points away from. And so I think this is just something that we're going to watch, and that I encourage everyone in our county to access this dashboard and keep on top of what is going on with COVID-19. The last tab here is called Our Response. This is just an update for anyone wanting to know what public health is doing and how we're responding to COVID-19. It gives we're kind of giving a metric on our ability to contact people and our response to the pandemic. This last tab here will actually link you all the way out to the data FAQ. So if there is a point of data on here that you would like to know more, where are we getting this data? What do the data points mean? All this information is included on our FAQs. And that sums up the COVID-19 data summary for today for the board. Thank you for your time.
Supervisor Burning?
I have a quick question. I had a constituent reach out to me for a group of more seasoned individuals who are wondering the vaccine, the availability, and can you guys lay out a timeline for St. Croix County residents and the priorities? Do you guys have any of that information yet?
Yep, I actually have a quick presentation, and vaccine is on that presentation, so I'm going to go ahead and share my screen. And I did get your email, Supervisor Burning, late last night, and I'm sorry I haven't responded, but I figured I'd be talking about it today. So let me share my screen.
And you're muted right now, Kelly. There you go.
Yep. I'm not muted now. So here's our update. How do we advance here? There we go. There's Ellie's data dashboard. I'm sorry I missed the queue. I had taken a call and shouldn't have done that. Ellie just went through our data dashboard. The other things that this is what we were going to talk about today. So the data dashboard, public health response, community response, and the vaccine. So we continue in public health. Vaccine planning, we are really shifting kind of our response to looking at vaccine planning. I would say I've been involved in vaccine planning since at a state level since the very beginning of when our state started talks of vaccine, and that was in the summer. So I've been a part of different groups related to rollout of vaccine and how that was going to go. Interesting how the state has kind of shifted a little bit. There was a group that was meeting probably at the end of July all the way till October to look at logistical things of the planning piece related to vaccine. And then come probably late or mid-October, the state said, we are going to halt this group and take another planning approach. So you will hear me refer to the SDMAC, which is the SDMAC stands for the State Disaster Medical Advisory Committee, and that is a committee that is really taking a lot of ownership related to prioritizing vaccines for the different populations in the state of Wisconsin. And I have links to their pages a little bit further in the response. As you can imagine, excuse me, vaccine planning it's a lot of moving parts. It's what I am calling in my brain, it's vaccine planning is a tiered approach. It's a tiered plan. We have to be planning internally for vaccine distribution through public health, as well as be aware of what's going on outside public health. And so, well, let me talk a little bit about how, in my mind, how this is structured is we have vaccine planning going on for our community. And then we have vaccine planning that the state has said to our long-term care facilities. They have made agreements and a plan with the pharmacy chains, CSV and Walgreens. And that program is going to be taking care of all long-term care facilities, assisted living facilities related to vaccine. So it is quite confusing. I wish I had a nice chart for you guys to understand all the different variances or all the different components rather of vaccine planning. So we have started vaccine planning internally as St. Croix County Public Health. One of the things that every local health department had the opportunity to do, and I may have mentioned this last month, we have to become vaccine enrollment providers specific to COVID-19. We've been giving vaccines in public health for decades, but specific to COVID-19, the state and federal government have said, we want to make sure all of the people in your organizations have the proper training on the cold chain, on vaccine storage and handling, as well as administration. So we have our staff that are all training to do that. We just got word last Thursday that we have been approved as a vaccine enrollment provider, which means we can start this week requesting doses of vaccine, and with the hope that we will have vaccine in our hands next week. So what does that mean? I'm really kind of focusing on vaccines here, and what I wanted to do is really talk about kind of how our response in public health is not changed completely from vaccine, but we're definitely adding a component to the response. We were disease investigation, contact tracing, really working with community groups and what they are doing and answering questions as far as critical partners as well as business community. The community response, we still continue to meet with all these groups. I am sorry for the abbreviations. CEOs are of the hospitals are CEOs and presidents, and CNOs are the hospital's chief nursing officers. So we continue to meet on a weekly basis with all these groups and answer questions, and I give an update on where we are at related to our planning in public health. We still continue with our disease investigation under our crisis standards. So currently we are contacting positive cases and having them identify their close contacts. We also worked, a big shout out to emergency support services. Right before Christmas, we were able to start alerting positive cases via our Rave system that some of you may be familiar with. Those are, the Rave alert system is a system that we have here at St. Croix County that we use often, not public health, but other departments use to notify community members of either disastrous tornado weather, severe weather. Sometimes I think community development uses it for other actions, and we have been able to use it to notify positive cases, which has been really helpful with especially if you go back to Ellie's graph and think about November for us. November was a crazy month. We were behind in contacting positive cases. So we were really able to use that technology to message out a person if they had a pending test, their next steps and what to do if their test came back positive. Okay, so let's get back to the vaccine. So I try not to watch the national news a lot, but I did turn it on over the weekend and was really surprised to see that some states are already vaccinating people outside of what we are calling 1A phase. And I have a next slide that'll show you kind of the phases. and you can maybe better understand this complicated process. So the FDA gave approval for 2 vaccines, the Moderna and Pfizer. Pfizer is the vaccine that has to be kept at ultra cold temperatures. Our state, as I mentioned, this SDMAC, the State Disaster Medical Advisory Committee, they are the ones that are making the recommendations on who should get vaccine and when. And then I have links in this presentation to both websites. The SDMAC's website, they post all of their meetings and their notes on their website. So if you're interested in, they also have public comment where you can make public comments to who should be vaccinated, and their committee is structured where they're looking at public comment to determine who should be prioritized. So here is, sorry, the slide is a little bit fuzzy, but this is really what vaccine planning, distribution, administration, this is really what it kind of looks like in a high level overview. So we, not we, but the government, the state have said, you know, we absolutely want vaccine going to, number one, front healthcare workers who are taking care of COVID positive patients or a very sick or very sick population, as well as making sure all the long-term care staff and residents are vaccinated. So they really fall into this phase 1A. So we have not even started 1A from a public health perspective in our county. However, that doesn't mean healthcare workers in St. Croix County have not been vaccinated. As I mentioned, public health departments enrolled in the vaccine program, as well as healthcare entities such as hospitals and clinics have also enrolled to be providers. So I do know from our hospital CEO meetings, we have started in St. Croix County vaccinating healthcare workers. We have seen really an influx in calls to public health from all kinds of various healthcare providers saying, when are we getting our vaccine? What is the timeline? The same question Supervisor Burning just asked. And the one thing I think that we are trying hard to manage is people's expectations and how fast we are and how fast we are receiving vaccines, and not just how fast, but how many. So we have to work through these phases. Pretty much in a linear process. We can't be jumping from phase to phase. We know we will be requesting doses so that we hope to receive them next week. We are working with emergency support services, specifically Janet Smith and Natasha in emergency management, to make sure that our EMS, so our emergency medical service personnel, they are also in this phase 1A. The thing with our emergency medical service personnel, some in our county are affiliated with healthcare systems and therefore got their vaccine from either the clinic or the hospital. But we have many volunteer EMS providers or entities that aren't affiliated, they are unaffiliated with a healthcare entity. So that means that we will have vaccine for them, and they will be our first priority, are the EMS workers who are unaffiliated with a healthcare system. So we will be planning vaccine clinics and taking appointments to get those EMS providers vaccinated. The big question in everyone's mind, and I think it's health departments across the state, is, okay, and in fact, I was on a phone call yesterday with smaller health departments. And when I say smaller health departments, I don't mean staff. I mean a health department that serves a much smaller jurisdiction than St. Croix County. I usually round up and say St. Croix County is roughly 100,000 people. And I know that is an overestimate, but it's a nice, easy number to use. So smaller health departments were saying yesterday, well, we plan that we don't have a ton of 1A healthcare providers in our small jurisdiction of 40 or less thousand people. And there was a lot of conversation about, can we move then to phase 1B, our essential workers? And I think that's the $1 million question that state hasn't said one way or another, yes or no, if you can. And I think we know what we know about home rule related to the state of Wisconsin. We can make those decisions locally. And we are just in St. Croix County, we are just not in a place where we can start vaccinating any healthcare worker that says, hey, I am, an LPN or a nurse practitioner or a chiropractor or a speech pathologist. So we are working on that, and our plan for vaccine administration right now is actually holding clinics on one day of the week, and we will have all this on the website once it gets once we get to that place in planning where people can make appointments. We will have a phone number in which they can call, and we'll probably do it a lot like we did wing testing in the very beginning. So when I say wing testing, I mean COVID testing that was put on by the Wisconsin National Guard. And it will be, please come between 2 and 2:30 to receive your vaccine. There are a couple special limitations with COVID vaccine. It is the recommendation that people wait after receiving a vaccine for up to 15 minutes after the vaccine is administered. So they can just be watched in a setting in case there were to be any severe reactions or adverse events. So they don't just get in their car and drive away. So that is, and this, I really anticipate this vaccine planning. This is going to be at least a 12-month process. It is going to be long. I don't anticipate we will be doing community clinics likely until late spring, early summer, which will be pretty timely when school gets out, as we do have agreements with our schools for hosting mass vaccination clinics. So that's kind of, it's not a great timeline, but this is kind of the slide that really looks like the phased approach for vaccine planning. And I think there is a question.
Supervisor Burning.
Yeah, so just in a follow-up to that, so we don't have a specific timeline yet, is that correct?
Well, as I said, vaccine will be coming to us hopefully by next week, and our priority will be our EMS unaffiliated providers.
Okay, and then one follow-up, even maybe not to that, but as far as like residents like wanting to get on a list, I guess would be what I think
Okay.
that was the question. Are you guys going to have something on the county website where they can register for that, so that when their phase comes, you can point them in the right direction, or are they to go to their medical provider? How is that being handled, please?
So that is a really good question. And right now we have been given an Excel document of prioritization, and I'm hesitant to say yes, anybody who wants vaccine, please call us. Only because we're not a huge department. We don't have a ton of staff to field calls, but we are populating a database that we have, I bet we have close to 50 providers who are not directly associated with like a health partners or a big medical organization, but more dentists or physical therapy places. So we are populating a database that we are keeping track and contact for those who are interested and want the vaccine and want to be notified when it's available to them. So yes, that is an option. We are also we're using technology as best we can to simplify things. We are looking at this week, setting up a form for those kinds of inquiries, where this form then we would get people's email, working phone number, first name, last name, and then that would also populate into a database where we could just pull that information and potentially, I haven't asked emergency support services about this yet, but potentially use that Rave system again when it is time to notify people of upcoming clinics or when they are due or could be vaccinated at a certain clinic. We would use that Rave notification for that same kind of communication to them. So I hope that's
well, one quick follow-up to that. Sorry, I'm going down the rabbit hole here. I guess what would be the one preferred way for the folks out there that are watching or that we can pass on to, the one preferred way that you would prefer that they get on a list or some type of like contact me when it's available in my phase? What would be the one preferred method for a said person, like one of our constituents, to get on that list to get the vaccine?
So right now, from my perspective, and staff might really be upset with me for saying this, I think the email, our COVID-19 email, is the best way to do that right now. We just don't have manpower to have verbal conversations and take and field all those phone calls. So I think email, it doesn't go away. We have somebody checking that email on a daily basis. And I know we have received many, many emails already that we're taking the information. I know Adam is on, but I do believe Adam plans to have a whole vaccine information page on the St. Croix County website. And I believe that will help provide direction, and answer some of these questions for residents who are curious about when will it be my time to get vaccinated. So I don't have a timeline on that.
And Kelly, yep, no, that's fine. I'm glad that you brought that up. So as Kelly said, there are a lot of moving parts with all of this information. So we are working on, right now on the website, we have a link for vaccine information that links off to the DHS, Wisconsin DHS website for more information about general information about the vaccines. But we are I'm working closely with public health, and we will have information up soon, hopefully by the end of the week, about vaccine information specific to St. Croix County. I don't think it's going to have all the information you are looking for right now, Supervisor Burning, but that will be a place where we will add information as we receive it.
Okay, thank you.
Judy Octroff.
Supervisor Achterhoff.
Yep. I don't know how else to do it because I waved my hand, but I don't know how to signal that I have a question. But I have two things. One is most of my questions have been answered, but I would also hope that when St. Croix gets the website going, especially for the vaccine, it can emphasize broadly that if you know someone who doesn't have computer access and fits into any of these phases when it comes time to please notify. Because, you know, as we know with broadband, it's pretty limited, especially on the east side of St. Croix County. And my other question is kind of, how is everybody doing in your department, Kelly? I mean, you have been under such unbelievable strain. And it's been going on and on. Is it getting, I don't know what the term would be, better, easier, what? But
Okay, so thank you so much for your questions. And the first one related to people who have shady broadband or not great electronic access. We absolutely are talking about that population and what is the best way to communicate with them and how do we get those people vaccinated. So yes, absolutely. Thinking and planning for how that will happen. And I can only speak from my perspective. At least as far as how we're doing as a department, I absolutely feel a lot of relief, I think, over the past couple of weeks. And I want to be careful how I state that because sometimes my words get twisted when I say things. I'm hopeful that we have turned a corner in St. Croix. However, I want to be sure, that we are not giving up our efforts or laxing on our efforts because, as you know, from the national news, there are different strains of vaccine. We haven't seen that, or variants rather. We haven't seen that in the state of Wisconsin yet. I'm optimistically hopeful that we have turned a corner. We're on this vaccine horizon. I'm feeling a little relieved. Ellie, do you have any thoughts? How are you doing, Ellie?
I think it's actually working in a sense of there is this now large shift within the department, and Kelly has been working so hard on shifting towards vaccination, but at the same time, we're still mounting this response to all of the infection that comes into the county. And it's becoming a balancing act. And I do hope that it stays a smooth transition, that cases do go down and people do still stay safe and they still wear masks. And then we can appropriately move towards mounting this vaccine response. And it isn't another issue of not enough people. And that's
Thanks. Good luck.
And Judy, sorry, I just wanted to say something about the first question. So I am working closely with public health. We are going to be issuing a newsletter, and that's going to be through direct mail. Part of the newsletter is going to have some vaccine information. And right now we're looking at 2 scheduled newsletters, one that will go out this month, and then one that will go out probably around March or April. And we're looking at having information about vaccines in both of those newsletters.
Thanks.
Further questions? Comments? Supervisor Counter.
Thank you, Mr. Chair. Can you hear me okay? Okay. I wanted to start out by stating that I had an opportunity to watch the Western Wisconsin Journal program that was done here a little while ago, and Miss Ellie Clausen and Miss Kelly Engen were both on there putting together a presentation on the new quality changes that have been done on the dashboard, and I just wanted to state it was a great job. I like the work that you did. I like how you presented it. It was well done and to the point. The one thing though that I wanted to bring up was that with the I found out about this particular program by some of the constituents or residents from District 11 that had called me and had some questions on it. I referred them to you for the questions, but unfortunately I was unaware that the program was even out there, and wondering if for some of these things we're not looking necessarily for any approvals or anything else, but just on some of these things if we're made aware when some of these things happen, so that we can watch it at the same time, so we're, we know when the public events are going out, so we know the background and some of the information, so you're not caught off guard.
Sure. Adam, do you want to take that?
Yes, I can. So that's a very good point, Supervisor Counter, and I'm sorry that we did not send an email out to the supervisors, and that's something that we can work on moving forward. We did work with River Channel to set up that interview, and the plan was to release that this week. I was actually going to release that later on today. But I am glad that you were able to see that video. So it's going to be available from our the St. Croix County Facebook page later this morning, and then any other interview that we have that we've scheduled moving forward, we will work to better notify the Board of Supervisors.
Question, Adam, could you also put that on the website too, a link to it?
Yes, we'll add that to the homepage of the COVID-19 page.
Further questions or comments? Supervisor Brennan?
Yes, I just got a couple other things. One I wanted to bring up. I have been in contact since this started on a couple of occasions with the government affairs liaison with McDonald's Corporation down in Chicago, and he sent me, which I can get to Ken if that's all right, and we can maybe distribute this, but this is an example of 50 policy changes that they have made at their store, and it's really an example not only of what they're doing, but a lot of that is being echoed throughout the small business community, throughout our county and state. And because a lot of the people in food service and hospitality came through a large Fortune 500 chain like McDonald's Corporation. And so with that being said, I'd like to get this, Kelly, I don't know if they sent that to you at all. Did they send that? I can forward that to you. That way you can see some of the things that they're doing. And if anyone in the county, any businesses in the county want to ask for help, I mean, they've put a lot of time, energy, and resources in developing some of the things that they've done. So I think that's important to know, that the businesses are taking this seriously and and are doing things to prevent the spread of COVID. And then there are some questions that some people had asked of me. I can probably take them offline with you, and I will take them offline, but I'll send you a separate email on that. But I just want to say thank you to the improvements on the dashboard. Your team did do a phenomenal job in remodeling that to make it more in-depth. So bravo on that. And with that being said, that is all I have. So thank you.
Can I just say one thing, Chair Peterson? I really want people to understand that Ellie Clausen is single-handedly done the dashboard. She deserves a ton of credit. She spent quite a bit of time. We did have input from others, such as professionals. We gave them a sneak peek, if you will, of the dashboard to let them take a look, some of our hospital CEOs and some other docs around our county. But she really deserves the credit on this. And yes, we are very happy to have Ellie with us. So just want to make sure she gets that credit. I don't want to take up more of your time.
Thank you for sharing that with us. Further questions, comments? If not, we'll move on to the financial county administrator's report. I will not reopen public comment.
So the financial report that's in the packet is the November report. The November report is probably actually a better report to compare than the December report. The December report, when that comes out next month, is going to show you what we've booked so far. But we actually continue to book dollar amounts into December all the way through about March 15th. So the November report has a more clear cutoff at November 30th. And when we compare it to last year, it actually is more comparable to look where we are progress-wise until we get to the final report for the year, which in March or when the auditors finish with it in August. But if we look at where we are for total revenues for the year compared to where we were last year, we're a couple of $1 million ahead of where we were for total revenues. We do have 11 million left, which is about 11%, which would be about on target. But compared to last year at the same point at November 30th, we're ahead on revenues. So that's a good thing. When we look at the total expenses then, back up a page here, we look at total expenses, and those also are about 2 million ahead, but where the revenues were almost 5 million ahead. So that's $3 million that we're doing better this year than we were at the same point last year. So there's a lot of other variables involved in that. If you look at unbudgeted expenses, those are at 12%. Revenues were at 11%. So everything's projecting out very close to budget compared to the prior year where we did end up finishing in the black. We're on target to do the same this year. So that's attributed to a couple of things. One is the strong sales tax growth that we continue to have. That's part of the revenues that we're seeing additional revenues for. And then also we did a lot of planning, at least in the mid part of the year, to reduce expenses. So we had a hiring freeze that lasted for several months. We asked departments to reduce their operating expenses. So you're seeing a reduction in total expenses because of that. So those things combined are going to reflect when we get to the end of the year. So we should have a good year financially when you look at it for 2020. And it's really long-term projections then for 2021, what the state's going to do with their biennial budget, which is coming up mid-year in 2021. That's going to have a huge impact of what it looks like going forward for us. But looking backwards, 2020 was fine for us financially anyways. There was other bad stuff that happened in 2020 though. So that's what I have for the financial report. KIP projects are in there also. Those are pretty much all on target though. So are there any specific questions on the financial report?
If anyone on Zoom, okay, anybody on Zoom there? No, no requests, okay, thank you. Okay.
All right, so we'll jump into the next item, which is the county administrator's report on emergency authority use. So with the resolution 15 declaring the state of emergency, this allows me to vary county policies, which affects county employees, for necessary means to combat the pandemic. The FCRA leave was extended into 2021. So one of the things we looked at, and one of the things that was requested last month was, what are we doing about employees that have been off with quarantine or continue to be off or will need to be off again? So FCRA leaves were extended. Those FCRA leave extensions, though, were not any additional or new time. It was an extension of the time if you hadn't used it previously. So that was one of the issues that we had, and we addressed it at the administration committee. We had reviewed what some of our options might be. But basically what we came down to was we would not extend the FCRA leaves. FCRA leaves are probably good for businesses to extend because there's a tax credit involved. We don't pay taxes. Governments are exempted from that tax credit. So it's no benefit for us to extend the FCRA. So we're replacing that with basically a new 80-hour PTO COVID leave. And so it's our own leave program that we're creating. It's in addition to any other of the leaves that we have, and we do have several other leave programs that are available to the employees, PTO and long-term sick bank. So this new 80 hours then is irregardless of whether they had used a leave in 2020 or not. It's for January 1 moving forward through June 30th, so that's the extent of the emergency resolution declaration. So I'm reporting that as I'm required to the county board. So this is the point where if you guys disagree with that, you get to tell me. So I'll pause for a second to see if there is any disagreement or questions on it. I see
Supervisor Achterhoff.
Yeah, I just want, okay, I want to make sure I understand this. Someone may have had COVID and they took 2 weeks off in 2020, and now someone else in their family has COVID, so they are also quarantined for another 2 weeks, and that is going to be covered because it's a new year? Do I understand that correctly?
Yes, we're sort of putting 2020 behind us, and we're only looking forward with this new leave program, starting January.
Okay, and it doesn't have to be the specific person that's ill, as long as they're, like, if their daycare shuts down for 2 weeks. That's part of this 2 week also?
Correct. We're using the same policies basically as the FCRA. So if you were eligible for the FCRA, you'd be eligible for this 80 hours.
Okay, but it still only covers 2 weeks. So if they
It
have
does.
to take more than 2 weeks off, they have to look at other options.
Correct, yep.
Correct?
Yep. We're trying to cover as many of the variables as we can. This may not cover every single scenario, and we'll evaluate those on a case-by-case basis. And if any exceptions to the policy are made, I would have to report that. But we believe this policy will cover nearly all of the situations that should arise.
Yeah, I do appreciate the fact that you're going to monitor it still case by case, because there's going to be the one or two that pop up through no fault of their own, where they're just being bombarded with having to take quarantine over and over and over again. So I was glad to see that. Thank you.
Supervisor Hall?
Yeah, thank you, Mr. Chair. I have just a quick question. It's more for just general understanding on the policy, not that it needs to change or anything. It's if somebody is working from home already and they have to quarantine because of a family member or themselves, is that considered in the policy, or is it if they are ill, like sick time?
Yeah, if they're able to work from home, we expect that they would continue to work from home. And that situation actually occurs a lot, where we have someone that is quarantined or maybe is even sick, but still able to work, where they do continue to do so. So then they
Thank
don't
you.
need to use any of the leaves.
Seeing no others there, that it, Ken? Okay, we'll proceed on with business items at the present time then, and the first one would be a resolution appointing Ken Witt as a county administrator and approving the employment agreement. Do I have a motion? Supervisor Long,
approve, Mr. Chair.
second by Supervisor Osnes, and discussion.
It's Judy. If no one's saying anything, I'll go ahead.
Supervisor Achterhoff, certainly.
Yeah, like I say, I don't know when I'm supposed to talk or whatnot, but out of curiosity, how much did we pay Slavin Management Consultants?
I believe, don't quote me, I believe it was within the neighborhood of $24,000, I believe.
And how many applicants were there?
11, and did we have,
Oh, okay. Were you checking on something or?
yes, I was. We thought we might have our citizen member online, but he's apparently not. So, Bob, did you want to, or Kara, were you going to, Kara, go ahead.
Thank you, Mr. Chair. Yeah, I just wanted to give a brief overview of the search committee process. So as you know, fellow board members, we selected Slavin Management Consultants to conduct that national candidate search. And they did interview, some county staff, board members to kind of get a better idea of the understanding of the needs and the qualifications for the position. So the search committee, if you remember, the search committee consisted of the committee chairs for the various things. So supervisors Peterson, Long, Osnes, Peavy, Hansen, Fiedler, myself, and then a citizen member. So the search committee received the applicants, the list of applicants from Slavin, and then we met on December 8th to discuss that and discuss next steps. But after a review of the candidates at that search committee meeting, and based on the qualifications of the candidates, there was a unanimous recommendation from the search committee to appoint acting County Administrator Witt to the position going forward. We did discuss, background check and, of course, a discussion about an employment agreement, which I believe is in the packet. But just for your awareness, the search committee felt unanimously that acting Administrator Witt would be most appropriate for that position at this time.
Chairman Peterson?
Supervisor Leaf.
So you didn't interview anyone? 11 applicants didn't interview anyone?
We did, the committee felt, no, we did not interview anyone based on the review of the qualifications of the candidates that applied. And I don't know if any other members of the search committee want to offer any comments.
Supervisor Long?
Yeah, I kind of figured that question would probably come up. And if you saw the other candidates, there were a few that might have been somewhat worthwhile, but when we really looked at all the candidates, we just really didn't feel that it would be worthwhile to incur the cost to interview. It was I guess very obvious to us that the right decision to make, and we did discuss it as a committee, and there was unanimous agreement that this was the most appropriate way to move forward.
I would speak if you'd allow, Chair.
I was just reminding Bob that also we were aware that acting Administrator Witt was also, I won't say in negotiations, but being offered other positions elsewhere also.
Mr. Chair?
Supervisor Hanson.
Oh, good. I just wanted to add that I don't want to speak too deeply on what the other resumes had to offer. It might be inappropriate to do that. And I anticipated this conversation also, and I wanted to hedge that early on in the conversation, because I don't want to disrespect any of those people. They all had very good resumes. Many of them were not county leadership resumes. They were not county executives, or they were county executives from very small counties who didn't have the kind of experience that we were asking for. It's just we had Mr. Tyler, who is the founder and CEO emeritus of OEM, which is one of the largest industrial corporations in St. Croix County, advising and working with us. And I felt very comfortable with him sharing the opinion of the committee, and he had a great deal of hiring experience. It just seemed that Mr. Witt rose above the other candidates, and the fact that he was being actively recruited and had opportunities, active opportunities, that it was the right thing to do. And I would ask that you take that into account as you place your trust in the hiring committee and approve this resolution in hiring Mr. Witt. Thank you.
Any further comments or questions? Supervisor Achterhoff.
Just one is, I hope Mr. Witt stays healthy and happy for a long time. And two is, we should possibly think, if we would have to be in the situation of looking, possibly use another consultant to get better applicants. That's it.
Well taken, point well taken. Thank you. Any other comments or seeing none, I believe we're ready to vote at this time. Do we need a roll call vote on that? Yeah, just for the record, Cindy, go ahead with the roll call vote, please.
Okay. Ed Schachner,
Yes.
Sean Anderson,
Yes.
Bob Long,
Yes.
Kathy Leaf,
Yes.
Kara Cook,
Yes.
Tim Hall,
Yes.
Paul Burning,
Yes.
Rick Otino,
Yes.
Bob Fiedler,
Yes.
Dave Osnes, Scott Counter,
Yes.
Dan Hansen,
Yes.
Scotty Yard,
Yes.
Greg Telejohn,
Yes.
David Peterson,
Yes.
Paulette Anderson,
Yes.
Judy Achterhoff,
Yes.
Shelley Tomschick,
Yes.
and Bill Peavy.
Yes.
It's unanimous.
Carries unanimously. Congratulations, Administrator Witt.
Thank you. No applause, remember. I appreciate the confidence, though, that you have placed in me, and I will do an excellent job for you. Thank you.
Okay, the next item then would be the budget amendment 2021, item 1, I believe it is on there. Motion for that.
I'll move to
Supervisor
approve,
Lonnie?
Mr. Chair.
Supervisor Counter seconds.
I second.
Discussion. You want to cover that, Ken?
So we did this as a budget amendment, really just for transparency. It's really a supporting page in the budget document that lists the additional pay types. So we have reserve auxiliary deputies that have not had an increase since 2013. At that point, what the sheriff told me was that they were being paid at the 75% of the starting rate of a primary service deputy. For some reason, that stopped. It hadn't been increased since 2013. So to change that and update that to the current rate brings it up to $21.53 for 2021. That doesn't affect the total dollar amount of the budget. That's why it's not actually a true budget amendment, because the amount for reserve auxiliary deputies is estimated every year. And so we estimate a set number of hours, so the rate goes up a little bit if you use a little bit less hours, and historically the sheriff has used less than the total budgeted hours. He will still fall within budget even at the higher rate. So this just catches those reserve auxiliary deputies up to the rate that we think that they should be at.
Questions or comments?
I think Judy.
Supervisor Achterhoff.
As usual. Is there any way we can put it in the budget some way that it won't be, why was it frozen? And is there anything we can do so that as every year as the increase in pay goes up, the auxiliary deputy rate will also go up so that we won't have to go through this again?
Yep, that's an excellent point, Supervisor Achterhoff. So that's why we're doing it as a budget amendment, so that it gets on a supporting schedule in the budget, so that it's visible. And so every year then we can just update that schedule, and the rate will then change as the budget's adopted. And so that's the way that I prefer to do everything, have it in black and white in the document that you approve, so that we're all on the same page of what these rates are.
And you probably have no idea how come it was frozen?
I do not, no. You know, when I started in 2016, it had already been frozen for 3 years. I was made aware of the rate, but nobody ever requested that it be increased. So until that request came through, we addressed it and resolved the issue.
Thanks.
No further questions or comments. I guess we're probably ready to vote. Do we need a roll call on that, Corp Counsel?
Yes. It's a budget amendment, so yes.
Cindy, roll call vote,
Sure.
please.
I'll start with Supervisor Osnes. Counter,
Yes.
Dan Hansen,
Yes.
Scotty Yard,
Yes.
Greg Telejohn,
Yes.
Dave Peterson,
Yes.
Paulette Anderson,
Yes.
Judy Achterhoff,
Yes.
Shelley Tomschick,
Yes.
Bill Peavy,
Yes.
Ed Schockner,
Yes.
Sean Anderson,
Yes.
Bob Long,
Yes.
Kathy Leaf,
Yes.
Kara Cook,
Yes.
Tim Hall,
Yes.
Paul Burning,
Yes.
Rick Otino, Riccotino? Is he there?
Yes.
Thank you. Bob Fiedler?
Yes.
Unanimous.
Carries unanimous. Thank you. Next item would be a resolution amending personal policies for personal leave, FMLA. Supervisor Long.
I would move to approve, Mr. Chair.
Do we have a second? Supervisor Burning seconds. Discussion. Ken, you want to kind of cover that?
Yep. So we're amending 3 policies. In the packet, we have kind of a detailed layout of the changes that were made to those policies. If there's any specific questions, we do have HR staff that's online that's available to answer them. So I guess without going into great detail over these policies, as we continue to rewrite all of the personnel policies and kind of a 2-year review that we're doing with them, if there's any specific questions on them, I'd be happy to answer them or have the HR staff answer them. So I guess I'm going to open it up for questions first.
Supervisor County.
Do any of the policy changes do you see for future changes would have any detrimental impacts to the budget?
No, I mean, generally I don't change policies that have a detrimental impact to the budget. I'm usually more on the fiscal conservative side, so I look to policies that support what we've been doing or policies that support strong fiscal policy. Generally what we're doing with the policies, one is reformatting them. So we're bringing them into a new format that's going to be easier to search and to find things by the employees or by anyone else that needs to search them. 2 is we're bringing them up to current standards. So things changed since the last time the policies were reviewed. So some of that language needs to be updated. And then 3, we kind of accumulate issues that come up over the years. And so we said, well, if this was in our policy, that would be great. So we add clarification to those issues as they've come up. And so that's what we're doing with this review. And like I said, we're reviewing all of the county personnel policies really at the end of the 2 years of this, and we're about halfway through. At the end of the 2 years, we'll have a whole new policy book completed at that time. Rather than doing it all at once, we're just breaking it up into pieces. And this policy these 3 policies are the FMLA, which is fairly standard. There isn't a lot of change in FMLA. Our personnel leave policy, a lot of that was clarification. And then employee benefits. And the employee benefits one was more of a reconciliation to what our processes are. And so we changed some of the language in the policy to match really what we're doing. And some of those changes were made because of system changes or health insurance plan changes over the years. We had to catch our policy up so that they were matching. So that's really the 3 categories of what we looked at here.
I have a question.
Go ahead, Supervisor Hanson.
You've scrolled down from the line, but it referred to other paid leave. What exactly other paid leave are we talking about? Is that what's the scope of the other paid leave that we're other paid benefits? Added language regarding the use of paid time if the employee is receiving other paid benefits. What's the scope of the other paid benefits?
This is Audrey Haycraft. I can speak to that. So if they were on workers' compensation or receiving short-term disability, which is an individually purchased benefit, part of the FMLA state law for Wisconsin is that we cannot require employees to use paid time off. And then also part of STD or short-term disability is also that if they are already receiving some type of paid compensation from outside vendors, that we cannot require them to also use paid leave during that time frame.
Okay. Any other questions or comments? Seeing none, we're ready to vote then. We'll signify, all those signify by saying aye. Aye.
Aye.
Aye.
And opposed? Carries unanimously, thank you. I'll ask, do we need maybe a 5-minute break? Does anybody feel they need a break, or shall we continue on with the business items? Okay, we can we'll proceed on with the business items and go ahead. Let's see, next one would be resolution authorizing broadband assessment, RFP, and motion.
I'll move to approve, Mr. Chair.
Second. I'm sorry, who was the second?
Me, Kara?
Supervisor Hoke, thank you. Discussion, Ken, you want to briefly cover that?
Thank you, Chair Peterson. So normally, we don't bring an RFP to the county board for a resolution to approve it. In this case, I'm doing it for a couple reasons. One is you've been asking what we're doing with broadband, so this kind of tells you then what we're doing with it. We're sending out an RFP to do an assessment of the county. The assessment of the county is kind of this next step where we're at. It's going to do an in-depth look at the county, where the current infrastructure is, where the underserved areas are, and then it'll identify future projects that could be done to get the most bang for the buck. And then what we'll do with that data is we'll go back and we'll work with those service providers and try to encourage them and maybe jointly write grant applications with them to the PSC so that we can get funding brought into the county to get those projects done and to start to serve the public. So this is the model that's been used in other counties, and so that's what we're doing here. And the first part is to get this assessment done, which is kind of a lengthy project that's going to take up most of 2021, but it's very necessary in order to target the most benefit of these projects. And then the other reason that I brought it forward as a resolution is it's not budgeted. So I don't have any budgeted funds for this. I anticipate using the contingency fund for it, though. We have $100,000 budgeted in the contingency fund. I think this will fall well underneath that amount. But I'm going to have to ask for funding later on. So I just wanted to be transparent about what we're doing with this RFP.
Supervisor Burning?
The intention of the RFP is to get the structural analysis of the county to see how we're set up, what are some good ways to deliver broadband to our residents. That's kind of that's our goal, right?
Yep, absolutely.
Okay, and then once that assessment is made, once we approve a vendor to do it, the vendor does it, they bring us back. This is what we found. These are the weak points. These are the strong points. This is the infrastructure that we have to work with and splice points and all that stuff. What are we looking at next steps? Like, what comes after that? And then I might have some follow-up questions.
Sure. Yeah, so there could be several different avenues. I mean, they could say if you built 10 towers that would be able to carry signal, that would be the best, and you should invest in that infrastructure and do that. That could be one of the results. They could say that your service providers just need to extend wire in the ground, and here's 5 areas that if they extended it, you'd cover 40% more of your population. So it could be any number of different project ideas that they're going to bring back to us. So those will be actionable items then that we'll have to decide on. Some of them may have a cost for the county, whether it's putting infrastructure in ourselves or whether it's encouraging the local providers to extend the service. May take financial incentive. And that's where I talked about co-writing PSC grants.
And so after that, I'm assuming there's going to be some sort of committee that meets on that. Are we going to do like some sort of ad hoc committee, or how are we going to do this? And I mean, I just have a pretty extensive background in telecommunications, so I'm just wondering about this
part
whole
of the
process.
RFP calls for a review committee to review the responses so that we can select a vendor. So there will be a committee formed, and I think we kind of left that open right now of who that is. But that group will then review the proposals, select the vendor, and that could be the basis then for a group that moves forward with the recommendations once they come in. Once the recommendations come in, we'll share that back with the full county board, probably in a presentation, so that everyone can see it and the public can see it also.
Further questions, comments?
Paul? Paul?
Supervisor Hall?
Oh, Supervisor Hall, I'm sorry, go ahead.
Oh, thank you, Mr. Chair. Just real quickly, this will consider a variety of different technological methods for delivering the service. Is that correct? We're not just limiting it to over the air or fiber. It'll investigate a variety of different delivery options. Is that true?
It does, correct, including 5G coverage.
Thank you.
Supervisor Achterhoff?
Yeah, my only comment is I hope that when they're selecting someone to do this, cost is a minor factor, because you need someone who's thorough and covers all areas of the county. I'm comparing this to the superintendent. I mean, to the search. I mean, there were, out of 11 applicants, 10 of them weren't worth doing. I want a group that will be thorough in researching and developing and finding information about broadband. And that also means having a way to get a hold of people who don't have broadband. Because if they use all this modern technology to find the information, they're going to be missing out on a lot. So that's my comments about that.
Supervisor Otino?
Thank you, Chairman. I would tend to disagree with Supervisor Achterhoff. I would like to see a cap of X amount of dollars on this, rather than just saying that we have a contingency fund of up to $100,000, because I can see how that could all get spent. We gotta start holding ourselves responsible for some of the money we're spending, and I would disagree with you. Thank you.
Further questions, comments? Seeing none, I guess we're ready to vote then at this time. So all those in favor signify by saying aye.
Aye.
Opposed? Motion carries unanimously. Thank you. Next item then is resolution in support of increased child support and funding. Are you going to cover that, Ken? Oh, I'm sorry. Yep, we need a motion for that. Supervisor Fiedler? Do we have a second? I'll second. Second from Supervisor Burning. Thank you. Go ahead.
I believe Lisa Plunkett is online. If you want to take that, Lisa, and explain it a little bit.
Yes, thank you. I just want to point out some key points in regards to this resolution. It's not a rare resolution. We had done it a few years back, and it's a goal of each county to present to the governor to increase our funding. In addition to the $4 million of state GPR funding per year that is needed to help child support agencies keep up with rising caseloads and new state and federal regulations, the increased state funds would draw down a federal match of roughly $7.7 million each year. An abrupt federal interpretation change in June of 2019 eliminated $4.2 million in federal matching funds for Wisconsin. Wisconsin's drop in performance relative to other states has resulted in the state receiving a smaller share of the federal incentive dollars. Wisconsin's share of the federal incentive pool decreased 2.598% in calendar year 2019 to 2.586% in calendar year 2020, which led to Wisconsin missing out on an estimated $70,000 in federal funds. Both the Wisconsin Counties Association and the Wisconsin Child Support Enforcement Association support this funding request. An investment in the child support program is an investment in Wisconsin's children's child support, reduces childhood poverty rates, and increases child well-being. For every dollar invested in the program, Wisconsin Child Support Agency collects $6.20. And Wisconsin's strong performance in child support is at risk without additional state funding, which could lead to additional reductions in federal funding. Does anyone have any questions?
Supervisor Counter.
I got a chance to review the resolution, and I just had a couple of questions for you. One, from what on the child support, as far as what the current state budget is, with the, I think you were asking, or we were asking for a $4 million increase. How much, what percentage of an increase is that? Is the first question.
So it would increase the, so let me go to my top here. Every dollar that we get from the federal government and we spend on the child support program brings a match. So the less funding we get and the less we spend, the less match. So we get 66% from every dollar spent in the child support program, and our funding has decreased based on state performance, and I think that's probably because of our increased caseloads. The current GPR funding for local child support is set at 9.010 per year. Does that answer your question?
I just want to maybe clarify, I guess what I was looking for is what the state is currently spending for a budget at this, because we're asking for $4 million. I'm just trying to look at what the overall state budget is for this particular item, if you have that available.
Let's see. $765,000 was provided in the 2019-2021 state budget.
And you're asking for $4 million more?
We are asking, because of the abrupt changes in that we got funding based on medical birthing costs. So when every dollar that we received in birthing costs expenses, we would get a federal match of 66%. So we have lost $4.2 million a year in federal funding for that loss. So that is a big decrease. And the state has held us unaccountable for that, or accountable for that money. They're going to give us that money for 2020, but for 2021, but for 2022, we are going to lose $4.2 million of federal matching. The $765,000 is the state budget that we have. I'm not sure of the federal budget, because the federal budget is all based on our performance.
What performance? I don't understand it.
So each county that each state has to exceed certain percentages in order to get funding. So the federal match, the $4.2 million in federal funding, draws down a federal match of roughly $7.7 million per year, because we can ask for 66% reimbursable funding to assist us in putting that money back into the program. So we're going to lose $4.2 million in federal funding. So we're asking for a $4.4 million increase.
Further questions, comments?
Judy Ockeroff.
Supervisor Achterhoff?
Has it been more difficult? I mean, if the funding is dependent on the money that you collect, what has this year been like with COVID and people losing jobs and I mean, how is that going to affect things? Or is it?
Are you asking for St. Croix County in particular or the state overall?
Probably both if you know the answers.
Okay, so in St. Croix County, we had to adjust our administrative processes, and we've had to take several cases into court to get modifications of support orders so that we can assist those that have lost employment or are receiving lesser in unemployment. So we're using more of our specialists in doing a lot of in-court actions or via Zoom or telephone to help participants get their obligations modified as needed. And then monitoring closely and communicating our communication with participants who haven't paid or aren't working, trying to get them on a track of working, looking for work. We've improved our Crossroads Program, which we work directly with the Workforce Resource and Job Center, trying to get people in those programs, trying to get them back on their feet. So we're trying to reduce the administrative enforcement to give them chances to get back on their feet. So administrative enforcement meaning like license suspension and account seizure and things like that, because we know that participants are struggling at this time. So we're doing the best we can to help them, but yet making them accountable to get back on their feet, find other employment, because there are a lot of jobs in St. Croix County. And so we want to move people towards that, even if it's a lesser paying job, and then modifying their support order. For the state, like I had indicated, we received 2.586% in incentive fundings in 2020 compared to 2.598% in 2019, which is about $70,000 in federal match. So the state, if we don't meet those benchmarks that the Office of Child Support Enforcement has enacted on us, the 90% paternity, the 80% in paternity establishment, court order establishment, and arrears collection, our funding gets decreased. Fortunately, St. Croix County, we pushed and pushed and pushed, and we met all 4 performance measures, but the state did not as a whole.
Mr. Chairman,
Supervisor Hard?
I will tell you directly that without child support services in St. Croix County, my office sees an incredible number of cases. Single parent families are one of my top priorities in my office. Because of the lack of child support services and funding, I see more and more, especially at this time during COVID. Without increased support services and without the federal matching funds, I will guarantee you that St. Croix County moving into 2021 and 2022 will see an increase in single parent families which are homeless, and we'll see an increase in children going on to state insurance rather than privately funded insurance through one or the other of the parents' employers. This is critical in maintaining an economic base in St. Croix County.
Further questions, comments? Supervisor Counter.
With the loss of the $4+ million from the federal government subsidy, do you have any knowledge, or could you help identify why those funds were taken away, and was it taken away in similar percentages from other states? And should we be looking to try to get those funds back from the federal government side?
Well, what happened was, I think there was an interpretation difference. So the state of Wisconsin was using any money that we collected for the state. So birthing costs are costs associated for children that are born to unwed mothers where the fathers weren't in the home. So they were not intact families. They were single households. So we could pursue against the father a certain percentage of those birth costs based on their ability to pay. And those were established through the court or a stipulation. So the court was involved with those. So our interpretation of that was that because we're collecting that money on behalf of the state of Wisconsin, we could get a federal match from the federal government. Well, that interpretation was incorrect. We can't ask for that federal match because it's considered revenue. So we have to pay back some money. I mean, it's not a whole lot of money if you look at the overall, but I don't know the number, but we have to pay back some of the prior years. I think back to 2019, we have to pay some of that money back to the federal government. But then the state held us harmless for 2020 and 2021. But starting 2022 is when we're not going to see those federal fundings. And that's about $4.2 million. In our county, in St. Croix County, when Katie Capon was the administrator, she had developed a process where we would go after any fathers who were supporting the family, whether someone that was in the home, someone that was supporting them. We would not pursue collection of birth costs. So this funding isn't necessarily the highest revenue for St. Croix County, but in some smaller counties like Buffalo and Pepin County and the smaller northern counties, they really relied on this funding, and a big decrease of this funding will affect those more dramatically than here in St. Croix County. Not that we didn't benefit from that funding, but not as bad as some of the smaller ones who definitely depended on that funding.
Further questions, comments? Supervisor Hall.
Yeah, so as I read this, so if I can boil it down for if I have to answer questions. So essentially, the federal government changed interpretation of how we were being graded. The state, as a result, lost $4 million in matching funds or grant funds. And that money, some portion of it, St. Croix County lost as well. And this resolution is simply requesting the state to make up for that loss going forward. Or are we asking St. Croix County to increase funding from the tax base?
We are asking the state government to more or less make up for the funding that we're going to be losing.
Thank you.
Okay, seeing no further questions or comments, at this time we're ready to vote then. All those in favor signify by saying aye.
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 And opposed? Carries unanimously again, thank you. And the next item then would be resolution supporting the creation of the Chippewa St. Croix Rail Commission. And Ken, you want to cover that? Oh, I'm sorry. Motion to bring that forward, Supervisor Peavy. And Supervisor Osnes seconds. Discussion.
All right, thank you, Chair Peterson. So we were approached by, I believe it was Eau Claire County, that's spearheading the creation of this. They're looking at forming a group that's going to promote the rail corridor that would come right through St. Croix County, coming north, turning at Eau Claire and coming over to the Twin Cities area. This is sort of a long-term project. The first part of this, though, is they're looking at a group that will create sort of the bylaws, the rules for really the bigger group moving forward. So that's the first part. So this is all that this resolution is committing us to, is to be at the table for the creation of bylaws for the group that's then going to promote the extension of the rail. So I think it's beneficial for us to be at the table to know what the ground rules are and be involved in that process. And then if we decide that we don't want to be involved, if there's a financial consideration that we're uncomfortable with, we can make that decision at that point in time. But right now, at this point of the process, I think it's beneficial to be involved. Does that explain it, I guess? It's multiple phases and multiple years, so.
Supervisor Byrne.
So if we choose not to get involved, like not have a seat at the table, can they run roughshod over us and put a high-speed rail through our county? Or do we have to have participation in order for this to happen? That's question one.
Yeah, I don't believe the county has any say in whether a rail comes through the county or not, whether we're at the table or not at the table. I don't know that that would be within our jurisdiction.
What jurisdiction does this fall under?
Probably the state, Department
State.
of Transportation.
Okay. All right, so this is going to
Chair,
form,
can I interject real quick?
yes?
Supervisor Hanson, go ahead.
Thank you, and that question was for the chair. Just going through the experience that we've had in New Richmond over the last 18 months with the railroad acquiring land and against the wishes of the townships and the city of New Richmond, they built a transfer yard where trains hauling automobiles will transfer the automobiles to trucks for transport. And nobody wanted this. 160 acres. It's a federal law. If a railroad wants to put a facility or a railroad someplace, a municipality or a county or a state has absolutely nothing to say about it. It doesn't matter if we're at the table or not, and that's proven just recently here in St. Croix County. So I just would like to share that.
Supervisor Byrne, go ahead.
Okay, so this doesn't fall under even the state jurisdiction. This is federal? And, I mean, can Corp Counsel speak to that, or, I mean?
I think Supervisor Hanson is generally correct. There's exemptions under the, I forget the name of the act. Certainly, the county wouldn't have any authority to stop it. So I think it is primarily a federal issue.
Okay, so even though it's coming through our county, it's already like, the railway is already like partitioned off as not being under jurisdiction of the county, so that's why they're able to possibly build this?
Correct. That the Congress has determined that there's a national interest in railroads, and railroads have been given a large degree of latitude in deciding how to provide transportation. And once again, I forget the name of the act, but I can give that to you. I'm not sure whether the state would be completely exempted from this, but certainly the county, in my opinion, wouldn't have any say as to whether a railroad's placed. Now, that's not to say it wouldn't be worthwhile to have some input on this commission, but that, I guess, that's a decision for the board.
Okay, so this resolution, as it reads, is strictly to form a body that would be, or have someone at the table or a group at the table for what's going to happen.
Yeah, so this resolution puts us at the table for the creation of the bylaws that are forming the group that's going to promote the rail project.
And so this is already in motion, this whole rail project? Because I remember being, and just, this is just like, I remember having this presented to me at another organization, and I looked at it and I'm like, this is a biopsy needle right into our workforce to be sucked out right into the Twin Cities. Because the times that this rail, they say 4 times, it doesn't hit any employment opportunities coming back into our state, and it sucks out our labor force, which prior to COVID-19, we were struggling hiring people. So, I mean, how, this is confusing that we could not have a say in putting a stop to this, but I guess that's where we petition our representatives. But I had asked something, so if you wanted to answer that or whatever. Sorry.
Yeah, if I could, and then I think Supervisor Hall will have a question after I answer this. I brought up on the screen, so it does talk about who's going to participate in different roles. And so the state DOT is listed in there. And so they have some role within this. And I look at this group as a group that's going to promote the rail project. And so that's where it's at.
So to follow up, it's not like this is going to happen and we're just giving you a seat at the table to pat you on the head or what? I'm trying to gauge. So this is not set in stone.
It is not, no.
Okay.
Yep.
That answers my question. Thank you, Ken.
Supervisor Hall, I believe you had a question?
Yeah, I just wanted to have a question / statement. So as I understand it, and it's been explained, we either have a say and an opportunity to influence or we don't by signing on to this. My understanding is there's no financial commitment from us nor any requirement for us to do anything other than sit and listen or contribute. I don't see any downside personally to this. Whether you're pro-rail or against the rail, I happen to be thinking that on the surface, this looks like probably a good thing for St. Croix County, bringing an opportunity for more trade, more interstate commerce with Minnesota. Whatever your view on it, I think it would be wise to have a seat at the table. That's all.
Supervisor Long.
Yeah, I do have some concerns about this resolution and moving forward on this rail project. For example, lines 30 and 31 in the resolution say that the development of the rail corridor is critical to the transportation needs of the county. Really? I really have a kind of an issue with that statement, and I have a hard time buying into that. I think there's so many other issues in front of us in the county right now that are much, much more important for us to be addressing and allocating our energies and our resources towards rather than rail development. All you have to do is look at the sheriff's report at the end of the packet and get a pretty good idea of a lot of the issues that are going on in the county. And the other thing is you have to ask yourself, what's the commuting going to look like in our post-COVID new normal world? We don't really know what that's going to be, and there's a lot of statistics in this in the packet here that I think a lot of those numbers are apt to change a lot in the coming years based on all these companies that realize, wait, there's a lot of value in people working virtually, whether full-time or part-time. And I think the commuting to the Twin Cities could change dramatically over the next couple of years. And so without really knowing, there's a lot of uncertainty there, I'm very hesitant to move ahead with this because I just think there's way too many other projects and other issues that we really need to direct our energies and our resources towards.
Supervisor Brennan.
So I agree with Supervisor Long that if we're putting all this verbiage and passing it, and all it is for us to have a seat at the table, I think, I'm not making a motion on this right now. Well, maybe I should, but in conversation, in discussion here, I think we need to simplify this then. I mean, if we simplify it to simply say that we have a seat at the table, we want a seat at the table, we want to be in the discussions, and if it's going to get, I guess for a lack of better terms, pushed on us, we want to have at least a say, but it does not say that, and it's not just that, and it's us backing, essentially saying this is critical. It's not critical. Broadband is critical, right? That's critical. Law enforcement right now in the city of Hudson with Minneapolis and St. Paul being shut down, that's critical. This is not. So I agree with Supervisor Long that I think we should push this back and redo it, redo the resolution.
Mr. Chair,
Who's asking there?
that's Dan Hansen.
Go ahead, Supervisor Hanson.
Thanks. the tone of this debate is sounding like we've already decided we don't want to be part of any real discussion, and I don't think that's the case. We haven't had any such vote. Right now, we just want to go explore whether we want to be involved with this or not. Yeah, it says that rail is critical transportation, but that's been borne out and proven absolutely on the Eastern Seaboard and elsewhere in the country. Besides that, as we discussed, if the federal government decides they want to put rail through here, they will. And there's no reason that we shouldn't participate at this exploratory stage. So I'd caution that we don't just condemn this project while we have an opportunity to be involved with the conversation. So why don't we just take a seat at the table? This has been in process for as long as I've been on the county board. When I was on the transportation committee in my first term, and both Mr. Peavy and Mr. Osnes can talk about that we've had that on the agenda at transportation for probably longer than my 7 years on the board, and we've known that this kind of thing is coming for a long time. So let's just go ahead and take that seat at the table, and then later on, and it may probably never happen, that we have to have this debate whether we're for or against it. But this isn't a debate whether we're for or against it. This is simply, let's just go sit down and see what they have to say.
Mr. Chair.
Okay, Supervisor Cook, have your turn, please.
Thank you, Mr. Chair. I think when we looked at the wording of the resolution that Supervisor Bernie and Long bring up, it doesn't say that this is a critical need and that means that other needs in the county aren't critical. It's talking about critical transportation. And I think that there are some issues in the county regarding transportation opportunities. And so I think at this point, we're not saying if we go forward with the resolution, other issues in the county aren't important. This is just one of the issues to consider, looking from a transportation perspective. And so I agree with Supervisor Hall and Hanson that I think there's value in us having a seat at the table. We're not committing to anything at this point. We're committing to being there and listening to the conversation. And I think that long term, even if we have no legal standing to do anything about it, if we disagree with the long-term outcome of this or not, it's valuable for us to be there as a stakeholder.
Supervisor Telejohn.
Yes, if you look at the information presented, it's not going to, at this point, it's not going to be a new line. It's going to travel over Canadian National Rails. They're looking at if they have to improve their lines or not to handle the passenger train. Also, why be ignorant and not learn anything about what's happening and step away from the table? Let's attend this and learn something instead of being ignorant.
Supervisor Tomczyk.
We need to be involved and know what's going on and put our input in there. Our county has very limited, if any, transportation options. As criminal law changes and there are offenses now that require lifetime bans on driver's licenses, we need to make sure that the people in our county have every option available to be able to get around, whether it's work or not. I mean, maybe us white collar workers are completely able to work from home or do the telecommuting, but that is not the case for everyone else. So we need to have a seat at the table so we can hear what's happening and make our voices heard and what it is that our needs are for our county.
Supervisor Henderson.
I have a question and a statement. So the question is, who would be or who would be appointed to this role? Where, like, what population would the person or people come from?
Yeah, I would recommend our corporation council at the first stage because they're creating the bylaws for the group. Alternatively, the highway commissioner would be my second choice.
And then my second thing is, if we sit this out, it might happen, or it's probably going to happen anyway. So my thought is, why not have somebody from our county be involved in this? It's not like it's drawing a ton of our attention or it's going to require any funding on our part. So I think it'd be beneficial for our county to be involved in this process.
Further questions, comments? Go ahead, Supervisor.
I want to clarify that what has been misconstrued by several fellow supervisors is not that I do not want to be part of this process. I do. But when we pass a resolution, Mr. Chairman, this resolution says that we are in agreement with everything that is in there, and it says that this is important and that we are for the joint, basically conjoining to joining forces to make this happen. We don't even know if we want it to happen. So I think if we're going to have a seat at the table, that language needs to be struck. I feel as if I make a motion to do that, it'll fail, but I'm going to do that. At this time, Mr. Chair, I would like to take out, I make a motion to amend the resolution so that lines 30 through 38 are removed. And, sorry, I didn't highlight this. 30 through 38. I'll go with 30 through 38 at this time.
Okay, I have a motion to remove lines 30 through 38 in the proposal, and a second to that.
I'll second.
Supervisor Long seconds. Discussion. Supervisor Long.
Thank you, Supervisor Burning. I'd also like to clarify that I'm totally in support of having a seat at the table, and I don't want that to be misconstrued either. But I'm also concerned about the resolution in and by itself, and that there's a lot more in here. Also, I wanted to point out, and I won't make an amendment to confuse the issue, but it also in lines 44, 45, and 46, not only does it talk about rail service, but it talks about advancing the public interest by pursuing implementation of rail service and other public transportation improvements. So there's a lot more meat in this resolution than I think just getting a seat at the table. So I totally agree we should be involved and get a seat at the table. I'm just really uncomfortable with the resolution as it stands and would support at least taking out lines 30 through 38.
Supervisor Otino.
Thank you, Mr. Chair. Also, the very title of the agenda item, it states resolution supporting the creation of the Chippewa St. Croix Rail Commission with counties and municipalities. I do not support this, and I'd like that struck out of there too. A resolution reviewing the possibility of creating the commission. But I am strongly against this. Thank you very much.
Supervisor County.
I'll start with a small one for now. I got up and was working at this starting about 4 o'clock this morning. So my notes are all over the place, not very well organized. But just on respect to the first item, the other one that I had concerns over was lines 40 through 42. What authority are we relinquishing under those lines? I guess that would be a kind of a question for legal counsel, but are we going to be developing something like the Met Council except for this rail line? You know, we looked at what's going on, and I did a considerable amount of research looking over with what's going on with the North Star line that runs from Minneapolis to Big Lake. And under COVID right now, according to the Star Tribune, they're 95% down in ridership. Before this ever happened over there, before the COVID even happened, The counties are subsidizing for each ticket sold. So that's one ticket for each way. They were subsidizing at $19 a ticket. According to what the current is, and this is from Metro Transit, just in August, the taxpayer subsidy was about $445 per passenger, according to federal subsidies. So the thing that I want to make sure is that we need to know what we're getting ourselves into. I'd really like to see a business plan of this. My concern is that if we are going to be partnering in this into a public-private partnership, what's our liability going to be to the constituents in the county? You know, I'm from District 11, Star Prairie, Stanton. How many members from our district are going to be using a service like this, and how much is it going to cost them to subsidize it? So as we go through this, I'd really want to know a little bit more about it, and then what authorities that we are relinquishing, looking at, by signing on to this as is, how is this going to impact us?
Ken or Corp Counsel, either one?
Yeah, and that's exactly why my recommendation is to be at the table, so that we have a full understanding and we would have some input into developing those ground rules. Because I think that what they talk about, this multi-jurisdictional commission, has a cost implication, and that's the next step after this. And so I think it needs to be evaluated at that point whether we want to be involved or not involved. But at this point, being at the table so that we have a full understanding of what's being committed to, and maybe could help put some limits into that where we would be comfortable, is where we want to be at this point in time. So all of your points are well taken.
Chair, may I be recognized?
Okay, Supervisor Hall.
Yeah, so this question would be for corporate counsel. The lines in question that Supervisor Burning and Supervisor Long are asking about, 30 through 38, is it your opinion that this commits us or requires us to take any action going forward to support this or not? Is this binding, would be my question.
I'm going to ask, so I'm trying to operate on my screen here. Ken, can you roll down to the resolve clauses? So this commits us so long as we're willing to participate. This is not a resolution that commits us for the rail service. It commits us to devote some resources to the development of an intergovernmental agreement and bylaws for the creation of the Transportation Commission. But those bylaws would have to come back to the board for approval, in my opinion. So this is just a resolution to start the process. Any agreement any proposed agreement, and you can make that a condition, it would come back to the board. So there's commitment of maybe staff resources, be it corporation counsel or highway commissioner or both of us. And at this time, I think that's it.
I believe probably it would be prudent to address the suggested amendment first, and then unless we have further comment on that, and then we can address the final draft, if that's agreeable with everybody. So at this time, this is for the amendment to the resolution of removing lines 30 through 38. And if you vote yes on that, it will carry. So at this time, those in favor of the proposed amendment indicate by saying aye. Aye. Opposed?
No.
No.
The motion fails. Motion fails. Okay, so
Oh, shit, I screwed it up.
we're back to the original resolution unchanged. Any
That was my
further
mistake.
discussion, or are we ready to vote? Believe we're ready to vote. Oops, sorry, Supervisor Osnes.
Mr.
Roll
Chairman?
call vote, yes.
Mr. Chairman? Mr. Chairman?
Okay, so
Mr. Chairman?
who's speaking?
Right
Oh,
here.
I'm sorry. This.
Well, I was just following up on what corporate counsel said about whether we would want to add any provisions in the resolve clause dealing with the motion coming back to us in the event we have personnel or financial commitments. That wasn't, the corporate counsel couldn't make that in the form of a motion, but if I've muddled through the intent of what he said, if he would like to agree with that or augment it, I'd certainly like to make a motion that agrees with what the corporate counsel suggested a couple minutes ago.
Corp Counsel?
And that's fine. I'm reading the last paragraph in the resolve clause. You could add a line that said, any such intergovernmental agreement and bylaws shall be approved by the St. Croix County Board of Supervisors.
Supervisor Achterhoff?
Supervisor Achterhoff, go ahead.
I mean, at this point, I'm getting totally discombobulated by all the different conversation about this. But if this is an agreement with multiple counties, federal government, state government, it's not going to give a hoot whether St. Croix County approves or disapproves something that they're doing in such a beginning aspect of this. All this is doing is setting up the committee and getting the bylaws. And then it's going to move on. And I don't see anything wrong with proceeding as it is.
Further questions, comments? Supervisor Fiedler.
Well, based on what the corporate counsel said, I think I would like to make the gist of what he was saying, a motion. I don't have the exact words in front of me, but basically it was, if there was an intergovernmental agreement, it shall come, and again, Mr. Cox, I didn't write it down quickly enough, but intergovernmental agreement, was it resources or funding?
Okay. Can you scroll back to the resolved?
I do have what you said, Corporation Counsel.
Cindy has the, Corp Counsel, Cindy has the reading. Go ahead and read what.
Can you read it back, Cindy?
Your suggestion was to include any such intergovernmental agreement and bylaws shall be approved by the St. Croix County Board of Supervisors.
So essentially, I'd like to make that motion that we include that in the wherefore clause.
I have a second
Be an amendment.
The resolve clause.
Resolve clause.
It'd be added to the paragraph on the resolved paragraph.
Okay, I have a motion to amend the agreement again, and do I have a second to that?
Second.
That was from
Supervisor Ard.
Supervisor Ard. Discussion?
I've got a
Supervisor
comment.
Hanson?
The question, wouldn't this come back anyway? Don't our bylaws already require that something that would require us to be committed financially come back to the county board?
Yes, but it may offer more comfort to those people that have a question about that.
Supervisor Ard, were you raising your hand?
No, we're good.
All right, I believe we're ready to vote on the amendment at this time as presented. Does anybody need that proposed amendment reread again? Okay, all those in favor signify by saying aye. Aye.
Aye.
Aye.
And opposed? That
No.
Okay, we have, the motion still carries. And so now we're back to the main motion as amended. Any further discussion? I believe we're ready to vote at this time, probably. Okay, I think probably on this one we will have a roll call vote. I have a request from Supervisor Osnes for that.
Ed Schockner,
Yes.
Sean Anderson,
Yes.
Bob Long,
No.
Kathy Leaf,
Yes.
Kara Cook,
Yes.
Tim Hall,
Yes.
Paul Burning,
No.
Rick Otino,
No.
Bob Fiedler,
Yes?
Dave Osnes, Scott Counter,
Yes.
Dan Hansen,
Yes.
Scotty Yard,
Yes.
Greg Telejohn,
Yes.
Dave Peterson,
Yes.
Paulette Anderson. Oh, I didn't know that. Okay. Judy Achterhoff,
Yes.
Shelley Tomschick,
Yes.
Bill Peavy.
Yes.
Passes.
Motion carries. Thank you. Okay, next item, annual department reports. Sheriff Knutson.
Thank you, Mr. Chair. As you'll see, normally I go through and kind of hit the high points of it. I know in some of the most recent department heads, it was if anybody has any questions, there's a large amount of information in there, so I think some of you guys have had ample time or some time to look through it, so I'll entertain any questions or do my best to explain some things or look into the crystal ball and see what we have for 2021.
Supervisor Osnes?
Scott, can you help us out with, when we're talking about the dispatch, are those guys okay as far as staffing right now, or are they holding their own, or are they gonna need some extra help before too much longer?
Also downstairs in the EOC is the command staff, so I'm gonna defer down there to Terry Anderson or Captain Brent Standard to discuss the staffing in there.
Okay, can you hear me upstairs? All right, yeah, we're sitting at 17 staff full-time. We still have one vacancy. As you know, we can't predict the call volume throughout the year, but as of right now, we're just short one person full-time, and we'll be opening more applications up for that possibly in the near future for that. Our call volume was up over the last year, so that's kind of where we're at.
Okay, thank you. Thank you, Terry.
Oh, I have, as long as Terry's on, Judy Achterhoff,
Supervisor Achterhoff, go ahead.
as long as Terry was on the phone, I was just wondering if they have any date yet about when they'll get the new mobile command vehicle. I know it's at some point, hopefully in 20 or 21, but is it 2021 or is it going to have to go off further?
It'll be this fall, approximately the September-October timeline. We'll receive the vehicle.
Okay, thanks.
Further questions, comments for Sheriff Knutson? Supervisor Long.
I read through the packet in detail, and I just want to thank you for all that detail. It was a tremendous amount of information, really gave us a real clear picture of all the challenges that you guys have been dealing with throughout the year, and I just really want to congratulate you and let you know how much we appreciate it and how much we support all your efforts and all the things that you're doing. So thank you very much.
Thank you, Supervisor Long, and obviously that's the great staff that I've had and have now, so much of the credit goes to them, and so, but thank you.
Supervisor Osnes?
Scott, with the opening of the, or the remodeling with the jail, is there a possibility that we could do it in smaller groups, but the folks in the county board that would like to come down and see the renovations? Are we able to do that?
However we can do that, where people are comfortable and we have no issues with quorums, anything like that, I will get people in. If it's a one-on-one, I will do that as well to.
I think that's a good idea, Mr. Chair.
Supervisor Achterhoff again?
Well, okay, I've got three more questions. Okay, one is, how many either inmates or employees have you had that have had COVID? I'm not asking for names, I'm just asking for numbers.
I'd say for those, we've had a number of those that have been positive. We've had more that have been close contact quarantines. I know at one point we had 17 off at a stretch in a week. But actually, probably those, I'd say maybe 10 to 15 have been positive. As far as the inmates, we've been very fortunate. We've had several, but we were able to move them around, quarantine, special medical attention. None became ill to the point of any hospitalization, but we've been very fortunate down there as well, and I'd like to believe it's some of the precautions that we have taken, and but we've been fortunate here.
Can I go for all three of mine and then stop?
Go ahead.
The second, okay, I just know that ammo for trap and skeet shooting is an incredibly low supply because my husband does both of those. What's it like for ammo for your people? Is that readily available or is that also low?
Ammo is very difficult to come by. 6-8 months, if not a year out. So we're already planning for what we need for 2022.
Oof. Okay. And my last one is a kind of a challenge. I'm looking at your mission statement. Can you please explain what, quote, provide for a safe environment, unquote, means?
I've got 38 pages of providing the best service with the resources available to apprehend criminals, try to make the citizens commute as safe as possible, running the jail to keep those that may be dangerous to the community, carrying out my duties of due process. I am here for public safety, and I will not change my mission statement, but thank you.
Supervisor
Thanks.
Hall. Unmute.
Yes, that's got to be the phrase for 2020 and 2021. You're on mute. This is Supervisor Hall. Real quickly, Sheriff, what are the plans for vaccination for your officers? I understand from a communication from Kelly that you guys are not classified as the first tier. Is that true? That seems odd.
That seems very odd to me. I've expressed my displeasure, but that's not a local decision. That's a much larger decision. I do have officers that are there prior to EMS on a number of cases, and we are the first ones in the door. So I'm as frustrated as that as well, and I know that's also been shared by this county from Natasha Cardinal down to the state as well. So we have fallen in line to the second tier. As for a rollout, I'm not sure. We have not specifically been in those conversations yet. I know some are looking forward to that within the next, hopefully, weeks, if not a month. But hopefully in February we are somewhere on that list.
Further questions, comments for the sheriff? Supervisor County.
Thank you, Sheriff, for all you've been doing for us, and the report was excellent. I did get a chance to read the whole thing. My question from you, or for you, after reviewing it too, is there was a lot of concerns that you had with the COVID and the things, how that's impacted the department. And my question is, has, as far as your reserve force and the main deputies, sworn deputies, are you comfortable, or have you been able to fulfill all the obligations that you've had?
Yeah, I believe we have fulfilled the obligations. And again, what we knew in March and April, information, just like society, it has, I believe, changed quite a bit. So there were some things that we really had to revamp. One of them was housing of inmates. That was, for me, a mind shift, and I know for some of the courts as well. But I believe we, knock on wood, we have made it with the decisions we've made as safely as possible for the community as well. Some of the investigations may have slowed, they didn't stop. Our investigators that worked from home still had phone calls going. We did, as you saw, some of the numbers that were impacted, search warrants, some of those deeper investigations. I know even some of our task force, multi-agency task force was cut back. So we weren't, unless if it was imminent danger, such as we knew there was heroin somewhere, or we were working on an overdose, those we pushed through with PPE. Some of the other ones that didn't rise to that level, we did put on hold. So that is reflective of some of the things, but those issues that were direct public safety need to be, we did not slow on those. And as far, the Hudson was brought up, and of course with that tragic incident that created quite a falling domino effect of events. The weekend prior to, we worked Thursday, Friday, Saturday, and we had a number of staff to include that task force. We bolstered our staffs in western St. Croix County, and we made quite a presence, and we had 317 traffic stops in those 3 days. It was as much presence as possible to, if anything, let the citizens of Hudson know that we were very active and hopefully ready to respond quickly if anything should happen. So that was a concerted effort with Hudson PD, our office, and some of the municipal agencies around the area. So.
Any further questions, Supervisor Fiedler?
Just a comment, Mr. Chairman. It's been my pleasure to work with the sheriff for the last 3 years and closely at the Public Protection and Judiciary Committee. The sheriff is always there. He usually has his deputy with him. He has one of his captains typically with him, or they're available to come up. We go over many, many issues. The sheriff has always been very forthcoming. And I know just not in our open work, but working with the sheriff closely, I know he and his office did enormous work last May when they had the incidents in Minneapolis, and of course in early December when he referenced the Hudson incident. And the amount of coordination that they engage in with our local police departments, our adjacent counties, and the state is enormous. And we don't have time, or shouldn't get into a lot of that in these sessions, but I just really want to compliment the sheriff and his office for everything they do to keep us safe.
Thank you, Supervisor Fedor.
Also, please accept my thanks, Sheriff, for your work and to your division from Multnomah County Board.
I will. Thank you very much.
Any further questions, comments? Seeing none, thank you, Sheriff.
Thank you.
Okay, we're to requests for future agenda items. Supervisor Fiedler.
Mr. Chairman, if you'll indulge me for just a second, I really won't be very long, but I do have a request. But I think it has a happy ending. So, but it's been changing and evolving almost by the minute. But let me just quickly, without going into all the detail, simply say that earlier in our meeting, in our public comments, Mr. Keller commented on an incident that occurred in the district where I'm the supervisor, and it involves both the complainant and respondent live in my district. So it's been of great interest to me what's happened. And The specific incident was a reference that was made on Facebook, but it led me to be thinking about the larger scheme of, do we need a code of conduct for ourselves and for those of us who are, for those in the county who are employees, as well as appointed officials of various boards and committees? And I think whether we do or not, I don't reach a conclusion, but I think it's at least worth considering the issue. And I think the proper committee for that is the Administration Committee. Now, what I had intended to do today, and information on what the complaint Mrs. Bachland had has been made available electronically by her husband, Matt Bachland, to all supervisors. I also have written materials on it that I will distribute to people for their information. But what I intended to do was to ask as a future agenda item that we consider this. Now, and a close reading of our bylaws suggests that if I do, it has to come up on the next draft agenda. But I really don't want it to come up on the next agenda, because this is a very serious issue that requires at least some in-depth consideration by a committee, not just ourselves trying to wing it with 19 people talking and having opinions.
Mr. Chair, I'd raise a point of order. This is off agenda.
So, Mr. Chairman, the happy ending to this, if I could just conclude, the happy ending to this is that I will not make a future agenda item request, but I wanted to say this because I think a lot of people have an interest in this issue, and I believe I can represent that the chairman of the Administration Committee will take this up as an agenda item at that committee. So I'm not asking that it come up as a future agenda item, but I do believe that for the public interest to know, because there's a lot of interest in the topic, I believe it will come up at that committee. Thank you, Mr. Chairman.
Okay, and just a statement. My personal feeling is that the county board, I would not be justified in spending taxpayer money or county resources in refereeing social media. All that said, we do have codes of conduct in place. However, I will forward for discussion only to the Administration Committee on that issue. Further requests? Seeing none, we'll move on to the clerk's report. Nothing from the clerk. Any announcements? I declare this meeting adjourned at 11:02. Oh, stand by. One. Sheriff?
Just real quick, as far as Supervisor Ochterhoff's question, 22 staff positive, 4 inmates were positive.
Supervisor Ochterhoff, you copy that?
I just got that text, so I apologize.
Yep, thanks. No, you answered everything, and your report was probably one of the most thorough reports I've seen.
All right, thank you.
Which says something about community development. Thanks.